Jarvis, how do I bring Dr. Dietrich on?
It should already be on.
All right, yeah, she's in. I'm just trying to bring her in.
Oh yeah, that's one thing we can't. You might can't do that right now. But I'm gonna be home in like a few seconds. Matter of fact, I'm gonna be
Okay. Okay. Hey, Dr. Dietrich, are you there? Okay. Okay, great. So, all right, so so everybody, I don't know if you guys can see us or not, but Dr. Dietrich Gorman and I are here to discuss the coronavirus update and all. And let's see here. And yeah, if you're in the chat or all, yeah, just type in your comments or questions. And Dr. Dietrich, I'm trying to turn your volume up here. Okay. All right. Okay, so, all right, so you can hear me, Dr. Dietrich? Okay, all right, great. So, okay, awesome. Uh, yeah, I'm great. I'm great. It's just been really, yeah, it's been a lot trying to keep up with the updates and all, and the press conferences and all with Dr. Fauci and Dr. Adams. Just trying to see, keep up with the number of cases and mortalities and things like that. I mean, so there's some good news and bad news that you and I have to talk about tonight. Okay. Let's see. And yeah, I will put a link in also. Let's see. Um, oh, I know. Okay. So yeah, if you can copy that link to your group, I'm copying it to my Facebook page. Okay. So, all right, DeJarvis, are you on there with us right now? Comments from the Facebook Live post will appear here. Okay, Dr. Dietrich, are you still there? Okay, Dr. Dietrich, well, yeah, just try to join me, come back on if you can. So, hey, everybody, this is Dr. Khadisha, your board certified emergency medicine physician, and I am here on for a discussion on the coronavirus. We're going to discuss some updates. Dr. Dietrich should be joining me anytime to go over with us the difference between like viral versus bacterial infections and more. And I'm going to talk about symptoms, treatment, testing, things like that. I know that, all they're talking about is coronavirus all day, but there's not too much there's not too much to it. Hey, Dr. Dietrich, you there? Yes, I can hear you. All right, so take it away, Dr. Dietrich. I can hear you. Um, let's see. Yeah, I can hear you pretty good. It's a little soft, but I can hear you. I can hear you clearly. I can hear you clearly. All right, thanks a lot, Dr. Dietrich. So, yeah, actually, yesterday I had to go in and do an unexpected shift because one of the older doctors had come down with some respiratory symptoms. And yeah, I think it turned out that he just had the flu. And we are getting a number of people coming in who are worried that they have the coronavirus, and and we test them for the flu, and that is advised that when you come in with the symptoms typical to coronavirus, we're going to test for more common viruses first. Um, yes, the flu presents very similar to the coronavirus. There's fever, cough. There can be shortness of breath if there is lower respiratory involvement, meaning lungs. And but with the flu, there might be some GI symptoms like vomiting or diarrhea, especially more so in children. So if you come in with fever, cough, shortness of breath, we're going to check you for the flu first. And from what I'm seeing, more frequently, it is the flu. And you know that there are cases scattered about the country, in DC, Philadelphia. Of course, it's the heaviest in Washington State. And here in the Houston area, in Texas, we have about 30 cases. 11 people are in quarantine. 20 so people are self-quarantined elsewhere. And I think we have our youngest case, which is a 3-year-old who caught the coronavirus from their father. But all of the cases that are in the Houston area are known to. Oh, I think Dr. Carol was is ready to join the broadcast. Hi. Hey, Dr. Carol. Dr. Carol, are you there? All right, so well, I'll continue on. So all the cases in Texas are known to be travel cases. The origin is known. There's no community spread, which is more concerning. And that's concerning because that is when a person spreads it to another person, and you don't know the true origin of it. All the cases in the Houston area, and in most cases so far nationally, are can be linked to travel. Be it the Egyptian cruise or the cruise that disembarked in Oakland a couple days ago. So with that testing, we test mainly for the flu first. If it's a child, then we may test for RSV first. Yeah, expect more of the flu just on a day-to-day basis. Okay, so basically, if you have meet certain criteria, if you meet certain criteria, such as travel from one of the affected countries, be it Italy, South Korea, Japan, Iran, those other countries, then they're going to talk about testing you for the coronavirus, especially if that travel has been within the last 2 weeks, because 2 weeks is the incubation period. So it could be from 2 days to 14 days. And you'll hear that many people who are in quarantine, they're going to be in quarantine for 14 days, which is the incubation period. Okay, um, so if you meet those criteria, fever, cough, shortness of breath, travel within the last 2 weeks to any of the countries, then oh, um, let's see, then we're gonna talk about testing for the coronavirus. And Dr. Anthony Fauci, and I'm sure you've heard his name a lot. Dr. Fauci is he's the national spokesperson on coronavirus. He's the head of the National Institute of Allergy and Infectious Disease. He let us know today that Quest Diagnostics and LabCorp, which are like two of the main companies that we do, um, two of the main companies that we do the lab testing through. Dr. Carol, you're on. Yeah, you're on the line with us. Um, yeah, so Quest and LabCorp are marketing and distributing the coronavirus test kits, and they're trying to get them to all the hospitals. The Surgeon General Jerome Adams said that there should be millions of test kits distributed this week, and cost will not be an issue. The Surgeon General and Dr. Fauci have also been talking with the major insurance carriers to make sure that all of us can be tested without worrying about the cost. So, and so once coronavirus testing is on the table, then you become a person under investigation because you meet those criteria. Being fever, cough, shortness of breath, travel to one of the involved countries within the last 2 weeks, because 2 weeks is the incubation period. I just want to drive that home. And then at that point, if you have mild symptoms and if you're a low risk patient, meaning that you are under the age of 65 and you don't have hypertension, diabetes, heart disease, you don't have lung disease, you're not immunocompromised as you might be with HIV, or if you're getting chemotherapy, or if you're taking steroids or something like that to because you're a transplant patient. If you are none of those, if you have none of those high risk conditions, then you may be expected to self quarantine, meaning stay home. Like some of the firefighters and healthcare workers out in Washington State who were exposed to some of the infected patients. So people with mild symptoms may be expected to stay home, whereas people with more severe symptoms will have to be quarantined in a healthcare facility while they're being treated. And the treatment, there is no treatment. Just like Dr. Dietrich was saying, with viral infections, there are no antibiotics. With the flu, though, there is an antiviral medication, and we are patiently waiting. Well, I would say anxiously waiting for the development of the medication that the American pharmaceutical company Gilead is developing. It's called remdesivir, Remdesivir. But that might be another year before that's developed, as with the vaccines. 9 pharmaceutical companies are working on a vaccine, and they're at various stages of the testing process, from preclinical to the start of clinical trials. And while word's going around that maybe something could be ready by August, really they're expecting the vaccine to be fully approved, after testing at least a year from now. So that's why we have to focus on symptomatic care, treating fever, the way we treat the flu and all the other viruses. Like Dr. Dietrich said, the coronavirus, different strains of it have been around forever. There are different families of viruses. So, and other than Tamiflu and ribavirin, which we have for the flu, maybe a couple other antivirals. That's it. All we can do is symptomatic treatment. So, and that's whether you're, whether you have coronavirus or not, while we wait for the treatment. So the really important thing is prevention. And Dr. Carol, are you with us now? Yes, you sound great. So yeah, Dr. Carol is going to tell us about prevention. And Dr. Carol, can you introduce yourself first? Okay. Yeah, my website developer is saying that yeah, we're having some difficulty hearing you. Um, okay. Let's see. Okay, because we are, let's see. All right, I just hit host chat and let's see, there's a staging button here. And let's see, there's a toolbar that, and I've got a button, a red button that says that we've been live for 32 minutes. Let me, all right, let me see, okay. And yeah, I'm just waiting to see if my web developer has any other advice. So yeah, it sounds to share your lot. Yeah, it says that we're on. Okay, so all right, so I'm live, but it sounds like they can't hear anyone else. So um, I don't think. Okay, Dr. Dietrich is saying that she doesn't think she was heard also either. Okay, so we may have to do a reboot so that both of you can be, yeah, okay. And then, oh, there's someone who's, okay, there's someone else who wants to join the broadcast though. Whose last name is Elliott? Okay, hi there. Okay, and say your name again. Okay, and okay, Dr. Elliott. Now it sounds like we are unable to hear anyone but me, unfortunately. So we're probably going to have to do like a reboot. Okay, all right, so we'll try that. All right, so I'm going to stop the live, everybody, okay? And then we'll restart. Okay. All right. So everybody, thank you for coming in, and I hope that the information that you did here was beneficial. And we will do another discussion. We'll do a discussion where we can hear Dr. Dietrich and Dr. Carroll. Hopefully tomorrow, but we'll see. And this will be an ongoing thing, like Dr. Dietrich had said, that it's probably going to be like a little mini series since Dr. Fauci said that this is likely going to be better before. I mean, it's going to get worse before it gets better. So I'm going to stop the live. Thank you for joining me tonight, and all of us will be on hopefully tomorrow, but it'll be announced. Okay, the time and date will be announced. Okay, thanks, guys.